Hi, you guys. Welcome back for our daily practice questions. It is day 230, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it's free and linked in the description. My website is also linked in the description and it houses all of the resources that I do offer. I also say if you're looking for a one-stop location, check out my business profile by going to Google and simply searching The Nursing Studio. It provides my telephone number where you can either call or text to get in contact with the nursing studio, the link to my website that houses all of my resources, as well as testimonials from previous review students. All right, y'all, question number one for today. A 55-year-old man with hypertension and diabetes presents for follow-up. Blood pressure is 152/94 despite lifestyle changes. What is the most appropriate first-line medication? Is it A, a beta blocker? Is it B, an ACE inhibitor? Is it C, an alpha blocker? Or is it D, a loop diuretic? Take a moment and tell me what you got, y'all. All right, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which is the most appropriate first-line medication? Now, y'all know I always tell you if the stem of the question is asking for a treatment, you need to run it back and see if a diagnosis has been provided. Now, here we're talking about hypertension and the lack of a controlled blood pressure reading, despite already implementing lifestyle changes. So y'all know with the blood pressure model, there's a few things that we need to look into to determine how to treat this patient, right? So this is a 54-year-old male, hypertension, diabetes, blood pressure is 152/94. So we know we need to implement medications. Remember, we implement medicines if we're exceeding that 130 to 80 to 89 range for those who have comorbidities. He has hypertension and diabetes, right? Now, being that he is diabetic, he also requires renal protection. Remember that patients who require renal protection with hypertension management, you are going to give them an ACE or an ARB, okay? So that will supersede for the first line therapy options. So an ACE inhibitor is your option here. So B is your best answer. All right, question number two. A 34-year-old woman presents with a 3-day history of dysuria, urinary urgency, and frequency. She denies flank pain or fever. Urinalysis shows positive leukocytes and nitrites. What is the most appropriate first-line treatment? Is it A, Cipro for 7 days? Is it B, nitrofurantoin, 100 milligrams BID for 5 days? Is it C, Bactrim, BID for 14 days? Or is it D, Augmentin, 875 milligrams BID for 10 days? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what is the most appropriate first-line treatment? So again, we got to look and see if they provided us with a diagnosis, right? And then in this scenario, they have not. So you know what I tell you. Then you need to run it back a step further and look at the assessment findings because we got to know what it is to be able to treat it. And as I always say, when we're looking at assessment findings, make sure if it is provided that you pay attention to the age, gender, and ethnicity, as this can help you to determine a diagnosis as well as how to treat. So we have a 34-year-old female with a 3-day history of dysuria, urinary urgency, and frequency. She denies any flank pain or fever. Now, the UA shows us positive leukocytes and nitrites, which lets us know that this is positive for a UTI, right? Now, the reason why the presentation is also important and the gender is when you are treating UTIs, we need to know if they're complicated or uncomplicated UTIs so that you can determine how long the treatment is needed, right? The duration of the treatment. So, first line therapy for UTIs is your macrobid, aka nitrofurantoin. So, B is your best answer. Now, this patient is classified as an uncomplicated UTI because it's a female with normal urinary symptoms that are associated with UTIs. She's not pregnant. This is not something abnormal. So, you can treat from 3 to 5 days because it's uncomplicated. So, your best answer is B, nitrofurantoin 100 milligrams BID for 5 days. Remember, uncomplicated UTIs we treat from 3 to 5 days, whereas complicated UTIs we treat from 7 to 10 days. Okay. All right. Lastly, question number 3. A 72-year-old female presents for routine follow up. She is asymptomatic, takes lisinopril for hypertension, and has no history of diabetes or heart disease. Her blood pressure is 128/74, BMI is 25, and she does not smoke. She has a normal cervical cancer screening history with consistently negative PAP results. She asks if she needs to continue cervical cancer screening. What is the most appropriate recommendation? Is it A, continue PAP smears every 3 years until age 80? Is it B, discontinue cervical cancer screening at this time? Is it C, continue PAP smears every 5 years indefinitely? Or is it D, discontinue PAP smears only if she has had a hysterectomy for non cancerous reasons? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states she asked if she needs continued cervical cancer screening. What is the most appropriate recommendation? All right, so let's see what's going on. All right, so with this cervical thing, the classic thing here, the very important, significant point here is she has a normal cervical cancer screening history with consistently negative PAP results. That's number one. Number two is her age. She's 72. 65 year 65 years year old and older with a normal history, you can discontinue cervical cancer screening for these patients. But it's recommended that you also explain risk factors, of no longer um, screening them. But if they are 65 years of age and older with a normal history, you can discontinue. So B is your best answer. Discontinue cervical cancer screening at this time. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, @1 at gmail.com. Everything that I do offer is linked in the bio of this channel, as well as my website. And as I mentioned previously, my website is also linked in the description of this video. And as I also mentioned, you can go directly to Google and just search The Nursing Studio, and it will bring up my entire business profile for ease of access as well. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.